Now, nearly every one of us has come down with a cold or flu infection, and many of us likely get several or more such infections in a year. Now, this is not surprising, as upper respiratory tract infections, or URIs, are the most common infections seen in primary medical care. There are likely over 200 different viruses that can cause a cold. And for many children, it is common to get 12 URIs per year. And experts estimate that people in the US suffer from more than 1 billion colds a year. And the most common symptoms of URIs include coughing, a sore throat, nasal congestion, and a headache. Although most of these symptoms are self-limited and non-fatal, symptoms can significantly impair the quality and productivity of your life. So after going through the COVID pandemic, I don't think there is anyone who doesn't fully appreciate the importance of having an effective strategy to treat viruses and acute URIs. This is important for a wide variety of reasons that are independent of the bioengineered viruses designed to make us sick. So it's wise to have a highly effective, bulletproof strategy to combat URIs, not only for the inconvenience they create by temporarily debilitating you, but as a resource against any future lab-produced bioweapons that targets you. And one of the most common symptoms when you develop a URI is an increase in body temperature, which we experience as a fever. So in this module, I'm going to share with you some of the most important concepts to understand about approaching acute upper respiratory infections. Although you might believe it's a good idea to lower a fever, doing so actually inhibits your body's efforts to defend itself against the infection. Using aspirin, acetaminophen, Tylenol, or other fever-lowering drugs will likely have adverse consequences that will prolong the infection and increase your risk of negative side effects, and actually potentially increase your risk of dying. And this is because fever is one of your body's vitally important defenses, and it's a sign that your immune system is working at its best. Virtually all animals, and even fish, naturally develop a fever when they're fighting a bacterial or viral illness, as explained in this paper from 2023. Now, a fever promotes both your innate and your adaptive immune response that increases antibodies which your body produces to attack the exact type of pathogen that your body is battling. Your body will also produce more interferon, which is a natural antiviral and anti-cancer substance, to help block the spread of the infection to healthy cells. And the higher temperature alone, independently by itself, can also help destroy the pathogens. For example, temperatures in the range of 104 to 105.8 degrees Fahrenheit cause a greater than 200-fold reduction in the replication rate of poliovirus in mammals and increases the susceptibility of gram-negative bacteria to antibody destruction. Now, there is a paper from the Journal of Thoracic Disease in 2015 that explains that there are two basic fields of thought when it comes to whether fevers are harmful or beneficial. The first is that fever should be suppressed because its metabolic cost far outweighs potential physiologic benefits in an already stressed patient. Now, its metabolic costs are not insignificant, though, because for every 1.8 degrees Fahrenheit that your body temperature increases, it requires 10 to 13% increase in your metabolic rate. This is one of the reasons why you frequently lose weight when you have a fever. Now, the second thought is that a fever is actually protective. It's an adaptive response that should be allowed to run its course under most circumstances. Now, the fever response is a hallmark of infection and has been shaped through hundreds of millions of years in vertebrates, suggesting that fever provides a strong evolutionary advantage for the survival of the fittest, and blunting a fever is likely highly maladaptive. Yet for the last century, most healthcare workers generally considered fever dangerous and a source of patient discomfort, leading to the widespread use of medications to lower the fever. And there's quite a bit of evidence that the increase in core body temperature that occurs during a fever is associated with improved survival and resolution of many types of infections. Now, a startling example of this is a study from 2014, which showed that when drugs were used to control a fever, there was a 5% increase in mortality in those infected with the flu. Cold-blooded vertebrates, which last shared a common ancestor with mammals over 600 million years ago, provide an experiment in nature in which we can examine the direct impact of temperatures on survival. The fact that fever has been retained throughout vertebrate evolution strongly argues that having a fever during an infection confers a survival advantage. And a classic illustration here is a paper published in Science nearly 50 years ago. Researchers infected cold-blooded iguanas with bacteria and then gave the iguanas the opportunity to seek heat with sun lamps. And all but one sought the warmth to raise their temperature. And guess what happened to that one who didn't? He was the only one who died. Next, the researchers gave the iguanas infected with bacteria fever-reducing drugs. The iguanas that were able to mount a fever despite the drugs were the only ones that survived. Now, I know this is a simplistic experiment, but it strongly supports the value of not suppressing a fever. One study done in 2023, this time on fish, showed allowing fever to run its course cleared infections at about half the amount of time it took for animals without a fever to heal. In addition to rapidly clearing infection, fever helped control the inflammation and repair tissue damage. Another study in warm-blooded vertebrates, rabbits, infected with the virus also found an increase in mortality when fever was inhibited with aspirin, as 70% of the aspirin-treated animals died because of infection, as compared with only 16% of animals with a normal fever response. Now, similarly striking findings were identified in critically ill patients in the intensive care unit. One group of patients was treated aggressively for fever, receiving acetaminophen every 6 hours if their temperature rose above 101.3 degrees Fahrenheit. The other group only received treatment if their fever reached 104 degrees Fahrenheit, which consisted of acetaminophen and cooling blankets until their temperature went below 104. The study had to be stopped prematurely because so many people in the aggressively treated group died compared to the other group. 7 deaths compared to 1. Now, just like the paper from 2014, these researchers concluded that aggressively treating fever in critically ill patients leads to a higher mortality rate. Now, even the highly conservative American Academy of Pediatrics, otherwise known as the AAP, acknowledges that there is no evidence that fever itself worsens the course of an illness or that it causes long-term neurologic complications. Why is this significant? Because this is the same corrupt and profoundly intellectually confused AAP that not only endorsed and embraced, but applauded. Yes, applauded the CDC's COVID-19 recommendations of jabbing kids down to the age of 6 months. If this isn't the epitome of professional malfeasance, I don't know what is. Now, getting back to fevers, despite much research directed to this topic, the exact mechanism of fever and its potentially protective effects are not widely agreed upon, although recent papers, as I will show in a bit, offer some great insights into the molecular biology of fever's actions. There is a really great review published in 2015 that dives deep into the molecular biology of precisely what beneficial changes occur during an infection to fight off this offending pathogen. The authors discuss how fevers boost the effectiveness of the immune response during infections by stimulating both the innate and adaptive arms of the immune system. If you decide to read this paper, I think it's only going to reinforce your understanding of the fact that not suppressing a fever during an infection is a very prudent and wise strategy. Now, there are some instances, however, when a fever does require medical attention. Let me give you a hint of what those might be. Any fever in an infant younger than 3 months old at all needs to be evaluated. Fever in a child between 3 months and 36 months old should be evaluated. And any time a fever rises above 104.5 degrees Fahrenheit or 40 degrees centigrade. However, if anyone is incoherent or has an altered mental state, they require prompt professional medical assessment regardless of their temperature. This red flag indicates a potential medical emergency that should not be ignored. So now that we've reviewed the evidence to avoid taking drugs to lower a fever, let's examine some other strategies that can be used to treat a URI. If your body has enough cellular energy and is provided with the appropriate resources, I firmly believe that most infections caught early enough can easily be short-circuited and prevented from becoming a debilitating and potentially terminal illness. Before we go into the specific intervention and ostensible magic bullets, I think it's important to appreciate there's some strategies that are exceptionally useful to protect you from ever getting sick in the first place. And what might those be? Well, I'm sure it's no surprise to many of you that lowering your seed oil intake will also decrease your risk of getting an infection. In fact, there's a study recently published in one of the highest impact journals, Nature, that can shed some deep understanding here. This study demonstrated that prostaglandins, or metabolites from linoleic acid that are produced through the cyclooxygenase pathway, are the main signal through which your brain recognizes the presence of a viral respiratory infection. The more prostaglandins that your body produces, the more severe the immune response will be, up to the point of developing a full-blown cytokine storm, multi-organ failure, and even death. In other words, what we call the flu may be nothing more than a symptom of PUFA, or polyunsaturated fatty acid overload, and the degree of that overload or excess LA that you have accumulated determines the course of the viral infection. Conversely, blocking prostaglandin effects at the receptor level or reducing their synthesis greatly reduce symptoms of a viral infection, as well as risk for organ damage and death. The study used aspirin to decrease the formation of these prostaglandins and inhibit lipolysis, or breakdown and release of the fat from the tissues. Well, I just finished mentioning in the last section that drugs should not be used if there is a fever. If a fever is not present, then it might be wise to consider a low dose of aspirin. A baby aspirin once or twice a day seems reasonable if you still have high levels of LA in your tissues, as this will slow down the release of LA from your fat cells and help prevent them from converting to prostaglandins. Now, you can also take a small dose of vitamin E, which will also inhibit lipolysis and has additionally been shown to have direct antiviral effects, and in this study inhibited SARS-CoV-2 by more than 90%. Now, this preprint study also found that vitamin E can block the replication and infection caused by coronavirus. And the study used the influenza virus for its experiments, but states that its findings are likely applicable to all other respiratory infections and viruses, including SARS-CoV-2. Now, there's a 2020 study showing an antiviral mechanism for glycine, in that it prevents the formation of something you probably never heard of, which is capsids. You probably didn't know that viruses carry around an outer shell of proteins called a capsid. And this capsid acts like a lockpick, in that it attaches to and pries open the cell membrane it is seeking to infect. The virus then hijacks the cell's inner workings, forcing it to mass produce the virus's genetic material and construct many viral replicas. The capsids are like popcorn kernels, pushing away the lid of an overfilled pot. The new viruses explode through the cell wall, and the cycle continues with more virus lockpicks on the loose. Now, since glycine prevents the viruses from forming a capsid, causing them to become unstable and unable to infect other cells, as they simply disintegrate without their capsid shell. Now, interestingly, glycine has also been recognized as an important amino acid nutrient to increase longevity, as it balances out high methionine intakes from animal protein. And you can get glycine by taking gelatin, collagen, or a glycine supplement. And if you're going to take a supplement, typically about 5 to 10 grams or 1 to 2 teaspoons a day is a good dose. Now, getting adequate sleep is crucial for maintaining a healthy immune system and fighting off viruses that cause colds, flu, and other URIs. When you don't get enough sleep, your body's ability to fend off pathogens is seriously impaired. There will be a future module on sleep, but for now, just understand that if for whatever reason you are not sleeping well, your risk for getting sick is significantly increased. There was a recent study in Lancet that confirmed this. During sleep, your body produces and releases cytokines, antimicrobial peptides, and lymphocytes that target the infection. Sleep deprivation reduces the production of these protective immune factors. As an example, research has shown that lack of sleep decreases natural killer cell activity, which is crucial in helping your body to quickly recognize and destroy viral infected cells before cold and flu symptoms start. Now, if this disruption in your sleeping cycle is combined with acute emotional trauma, you have an exceptionally high risk of getting an infection if you are exposed to someone who is infectious. If you continue with poor sleep and emotional traumas, it will elevate your cortisol level, which will also worsen the problem by suppressing your immune function. Now, I'm not warning you about the dangers of poor sleep and increasing your risk of infections to create fear or catalyze you some obsessive behaviors, because in most cases, we have extraordinarily little control over poor sleeping events or emotional traumas. I only mention it to make you sensitive to your increased risk so you can carefully monitor for signs of a URI and start prompt treatment so you can stop the infection in its track. Now, one of the silver linings of the COVID pandemic is that it taught us some very valuable lessons regarding the treatment of upper respiratory infections and the risk factors for dying from these infections. For those under 50, there were 3 common denominators in those who passed away from COVID. They were being overweight or obese, having high blood pressure, and having diabetes, or a combination of all 3. Well, these sound like 3 entirely different problems. There are merely all just symptoms of a more foundational problem, which is the inability to create cellular energy that results in secondary insulin resistance. So the most important strategy you can take to target insulin resistance is to address the foundational causes of your inability to create adequate, or better yet, optimal cellular energy, as this will not only radically decrease your risk from dying from a viral infection, but pretty much all of the diseases it will assist. It will also radically improve your health overall. Now, I believe that applying bioenergetic principles to your life is the most important and effective strategy you can implement to restore your metabolic flexibility and resolve your insulin resistance. Once you start learning bioenergetics, you will understand that you are not insulin resistant because you're eating too many carbs or calories or you're not moving enough, but it's simply because you are not eating enough of the right types of foods to allow you to burn glucose as the primary fuel in your mitochondria. It is important to understand, though, that this is not a specific diet to follow at all, but rather a broad set of principles that allow you to customize your food intake depending on your specific unique circumstances. Now, there's many underlying factors involved that you will need to understand, such as hidden infections in your gut causing endotoxin release, the difference between simple carbs and fermentable carbs, and the powerful damaging effects that stress hormones can have on your biology if you're simply not eating enough food. Now, remember, changing your diet is far more of a marathon than a sprint, as you want to make changes cautiously and slowly and listen to the feedback that your body gives you so you can adjust the program in real time. The last thing you want to do is blindly follow some generic guidelines and ignore the feedback from your body. I'm really, really excited about the enormous boost that this approach will provide to your immune system and your overall health once you start to implement it. Not only will it provide you with a powerful shield against any infection that is thrown your way, but it will also help to slowly reverse any chronic disease you may have. Now, let's get back to treating any infection you may encounter. There's a good reason for the sequencing of the modules I am providing you with in this course. If you're eating foods that optimize your mitochondrial function and avoiding ones that break it down, along with getting regular movement and sun exposure, your immune system should be able to help you easily resolve most infections. If you've adopted and implemented these strategies, you have radically reduced your likelihood of ever getting a URI. This is one of the reasons why I put the sunlight module first, because not only does it help you increase your vitamin D levels, but it also provides many other benefits to support your immune system. And to highlight this, there was a study done in COVID that showed that when vitamin D is exposed to sunlight, it forms a photometabolite called lumisterol. Vitamin D and lumisterol inhibited SARS-CoV-2 by 50%. It's important to recognize, though, just as I explained in the first module on sunlight, that it is not just vitamin D. It's vitamin D and sunlight that is the magic that catalyzes immune improvement in your body. This is just another confirmation that you need regular sun exposure, and merely relying on swallowing a vitamin D supplement is not your best choice and actually an inferior option. But it is even more important than just protecting you against future infections. These strategies will help extend your lifespan and decrease your likelihood of ever acquiring any chronic disease. Now, in addition to these dietary changes, you're certainly going to want to optimize your vitamin D levels. The only way you can do this is to measure your vitamin D level in your blood. If you're unable to get regular sun exposure around solar noon, make sure you are dosing yourself with vitamin D, as I discussed in the first module on sunlight. Now, additionally, if you live in the north and it's the middle of the winter, even if you're outside of solar noon, you're not going to be making any vitamin D. So you're going to need to consider taking a vitamin D supplement. So in addition to making sure your diet and vitamin D levels are optimized, I want to review the emergency Band-Aids you can use if you do get sick. Please understand, though, that these are only Band-Aids in your first aid kit and were never meant to be the long-term solution, which is focusing on the strategies I just reviewed. Now, zinc is an essential mineral for the normal development and function of your immune system. It is not only protects against susceptibility to pathogens, but also mediates natural killer cells, activates T lymphocytes, and regulates macrophages. There was a paper published in 2023 that showed that in COVID-19 patients, oral zinc was able to decrease ICU admission rate and shorten symptom duration of COVID-19, while an earlier paper showed that those with zinc deficiency had a poor COVID-19 outcome. Now, both these papers support the use of this safe and inexpensive mineral to help treat viral infections. But the zinc needs something to drive it into the cell, and for most people, quercetin seems to work well. There was a study published about 10 years ago that showed quercetin in EGCG, or green tea extract, helps to drive the zinc into the cell where it impairs viral replication. A more recent paper showed that quercetin by itself may also be effective as a potent antiviral, especially against SARS-CoV-2. So for dosing, a reasonable consideration would be to use the zinc about 15 milligrams 3 times a day, and each dose taken with quercetin 500 milligrams. It's important, though, to not take zinc long-term, probably no more than 5 days or less if you're feeling better, as it could lower your copper levels. Now, this is especially important as the last thing you want to do is overdose on zinc. If you are regularly eating animal proteins, you're likely going to be getting more than enough zinc in your diet. If you're not, you're going to probably want to consider supplementing with about 15 milligrams of zinc. Now, you can also use vitamin C, which is promoted as an antioxidant, but actually works because it's an oxidant and lowers reductive stress in your mitochondria to help improve energy production. Now, I'm going to discuss reductive stress in a future module, but it's just too complex to review here now and kind of a tangent off the mark. But getting back to vitamin C, there are many ways you can take vitamin C or ascorbic acid. If you're seriously ill or being treated for cancer, most likely the best way is to take vitamin C parenterally through an IV, as you can take high doses in the range of 25 to 50 grams without any concern about causing loose stools. However, most people will not have access to getting an IV of vitamin C in a crisis. It's just not going to happen. You will only have access to the oral version. The problem with most oral forms of vitamin C is that at higher doses, they tend to cause loose stools. This is one of the reasons I'm not a fan of taking most oral vitamin C supplements and much prefer the liposomal version, as when vitamin C is combined in a liposome, it is more readily absorbed into your bloodstream and does not stay in your colon to cause diarrhea. Now, I want to take a slight tangent here and discuss taking vitamin C as a daily supplement, as many have questions on this because this is a widely recommended strategy in natural medicine. However, please understand that I'm not a fan of taking daily vitamin C supplements for your health. This is largely related to the fact that, in my view, there's a major difference between whole food vitamin C and ascorbic acid that is typically marketed as vitamin C in most supplements. We only need about 250 milligrams a day of vitamin C, and if you're eating plenty of ripe fruit, then this is a non-issue, as you will likely get twice that from the fruit you're eating. I happen to have acerola cherry trees, and when I eat those, I will typically get several grams of vitamin C in a day. Now, there are many differences that you need to understand between whole food vitamin C and the ascorbic acid you buy in a vitamin C supplement. One of the most surprising is that ascorbic acid will not cure scurvy, while whole food vitamin C does. Ascorbic acid is actually an isolate or a distillate of naturally occurring vitamin C, which has over 150 phytonutrients in this massive vitamin C complex. Many of the important ones are flavonoids for strengthening your blood vessels. And there's also J factors, which help increase the oxygen carrying capacity of your red blood cells. And finally, a whole food vitamin C has a tyrosinase enzyme that is loaded with copper that most of us are depleted in. Now, getting back to using ascorbic acid as a drug and not a supplement, which in my view is perfectly acceptable, I've already mentioned the problem with normal oral ascorbic acid is causing bowel problems with most people if your dose is too high. This is why I suggest using liposomal vitamin C and recommend that you have some in your emergency kit. You can take pretty large doses of liposomal vitamin C and not get loose stools. More importantly, when the vitamin C is in the liposome, it gets more readily absorbed into your blood, and this gets transferred into your cells where you get much higher levels of the ascorbic acid, where it acts as an oxidant to help your body destroy these invading pathogens. Now, liposomal C works far better when you take it as the first sign of an infection. So you can easily take 1,000 to 2,000 milligrams every hour the first day until you're feeling better. There's no reason to continue such a high dose, though, long term, and you should decrease the dose as soon as you start to improve. Again, I'm not a fan of taking maintenance or daily supplemental vitamin C and believe that you are far better served getting your vitamin C from whole fruits. Now, when you're sick, though, you typically lose your appetite, so it makes sense to swallow some high-dose liposomal vitamin C when you're sick. Now, molecular hydrogen is another excellent strategy that you can use, particularly if you're struggling with COVID. Tyler LeBaron, who's founder of the Molecular Hydrogen Institute and has his PhD in molecular hydrogen, he did an excellent lecture on how molecular hydrogen works, which should be on this page that has this module. In his video lecture, he explains the pathophysiology of COVID-19 and the rationale for why molecular hydrogen is being recommended by many prominent physicians and organizations for COVID-19 treatment. Now, molecular hydrogen tablets are the most common method of using this intervention, and doses are 1 to 2 tablets 2 to 3 times a day, typically in about 8 to 16 ounces of water, and you have to make sure that the tablet fully dissolves. It typically takes about 90 seconds, depending on how hot or cold the water is. Inhaled hydrogen gas is probably better, but the devices that produce this are costly and not easy to come by. So this pretty much summarizes my take on the basic supplements that can assist you in the recovery from an acute infection. But please understand that this is not meant to be a comprehensive encyclopedic list of every supplement you can use to treat an infection. There are many other excellent supplements that are useful, but these are my favorite and the ones I have experience with and I'm convinced are useful, and I don't want to overwhelm you with too many choices. But if you have your favorites, then feel free to use them. But I am convinced that almost anyone needs to resolve the infection is my favorite intervention, which is nebulized hydrogen peroxide, as I believe it is the single most important intervention that I am currently aware of in helping your body recover from these acute upper respiratory infections. We've been using hydrogen peroxide for medical purposes for over 2 centuries. It began with its discovery by a French chemist, Louis Jacques Thenard, in the early 1800s. It was first used back then to treat skin infections, and it was found that there was actually a Goldilocks dose, meaning that at low concentrations, it could effectively sterilize wounds, but at higher concentrations, it actually caused serious cellular injury. You might be surprised also to learn that in the late 19th century, nebulized peroxide was commonly used to treat infections of the upper and lower respiratory tract. And it was considered far superior to many other of the antimicrobials used at that time, such as, believe it or not, mercury. Now, it might seem a no-brainer that mercury, knowing that it's a potent neurotoxin and should never be used therapeutically in humans, but this has only recently been adopted by conventional medicine, believe that or not. Now, I suspect many of you might even remember a topical antiseptic called mercurochrome, which had a distinctive staining red color, and I do mean it stained. It contained about 5% mercury. It was very popular and widely used from the early 1900s up until the late 1990s, and only was taken off the market by the FDA in 1998. It was very clear in the 1800s that peroxide was vastly superior to mercury, as it could not only reduce the level of microorganisms, but also could clean wounds and allow the body's immune system to resolve the infection and damage. However, research on the antimicrobial use of peroxide took a back seat with the discovery of the antibiotics, the wonder drugs of the 1940s. So even though peroxide was essentially abandoned about 80 years ago, it was picked up again near the end of the 20th century by Dr. Charles Farr, and he used it as an intravenous therapy for infections. And soon after that, Dr. Frank Schallenberger, who's a prominent alternative medicine physician, recognized that you could actually nebulize it. And we're going to talk about that in a moment. And he found that it was equally as effective as the IV. This was great news because a nebulizer is so much easier to use than an IV and is far more cost effective. Nevertheless, some studies were conducted and researchers learned precisely the type of infections that hydrogen peroxide was good for. If we look at figure 1, we can see some good news as peroxide is most effective for the envelope viruses like the flu, hepatitis B, and SARS-CoV-2. It's also really good for killing gram-positive bacteria like staph and strep, and is also effective for the cold virus. It's less sensitive for gram-negative bacteria that produce endotoxin in your gut, and virtually worthless for infections that involve bacterial spores and parasites. Now, if we examine table 1, we find that overall hydrogen peroxide may be considered one of the closest antiseptics to being ideal, and it is likely why it is one of the most widely used antiseptics for medical, veterinary, and industrial antimicrobial applications. It's relatively stable, environmentally friendly, and at the right dose, it's easy to use. There's essentially no toxicity, and this is why it's so strongly recommended. It's natural, safe, easy to use, and very inexpensive. But how does hydrogen peroxide work? The short answer is we don't know, but we have some suspicions. And for providing that, I want to go to one of my favorite medical journals, which is Nature Reviews Molecular Cell Biology. They published this article, Reactive Oxygen Species as a Pleiotropic Physiological Signaling Agent, in April of 2020. Now, this is probably the best paper out there that reviews the molecular biology of how peroxide works in your cells. And I believe knowing this information can give us a clue as to just how nebulized peroxide might work to effectively abort acute viral infections. It's highly likely you may have never heard of the term antagonistic pleiotropy, but in biology, it merely refers to a concept that one gene can influence 2 or more seemingly unrelated traits. And if the genes generate opposing effects, for example, both harmful and beneficial to an organism, it's called antagonistic pleiotropy. Now, it turns out that hydrogen peroxide is very tightly controlled in your body because it is a powerful redox signaling molecule, as you can see in this detailed illustration of peroxide signaling pathways. Now, I realize that this seems to be unnecessarily and overwhelmingly complex, but I believe it does a brilliant job of illustrating the many profound ways that hydrogen peroxide is integrated into your biology, and reinforces the concept that when you inhale hydrogen peroxide into your lungs, it is not just acting as a topical disinfectant, but likely has some influence on many of these important pathways. If you're interested in the details, you can just put video on pause or on hold and then look at some of these pathways more carefully, or you can download the PDF of this paper and review it in the PDF. So one of the ways that the peroxide may work as a signaling molecule is that it is used by myeloperoxidase, which is a very powerful enzyme that generates a profoundly important oxidant called hypochlorous acid, which is used by your white blood cells when they're targeting the destruction of pathogens like viruses and bacteria. Now, if we're ever able to get by the narrative introduced by the globalist, redox medicine has so much potential in biology. Now, this paper explores how therapeutic interventions using reactive oxygen species are now entering clinical trials, and the redox implications are nicely illustrated in the paper in Figure 5. The most prevalent and best studied reactive oxygen species is hydrogen peroxide, and it's now forming the basis for the concept of therapeutic redox medicine. So to summarize, when your body is confronted with an infection, it signals your white blood cells to generate hypochlorous acid and other oxidants from hydrogen peroxide. And these oxidants are then used by your cells to kill the pathogens. So nebulized peroxide can also act as a topical disinfectant directly on the epithelial cells or the lining of your lungs when you inhale it. And it can serve as a biological signaling molecule or both. We don't know for certain, as the studies simply haven't been done. So considering that hydrogen peroxide nebulized is an inexpensive and incredibly safe treatment, especially if you're using food-grade hydrogen peroxide, when used in the appropriate concentration, is essentially no toxicity. It would seem rational that it would be beyond reasonable to try this as a simple strategy, not only treat, but prevent any viral infections you may encounter. Now, if you do consider using this treatment, it is very important to remember to treat the infection as early as possible. The sooner the treatment starts, the more likely viral replication will be impaired, and you won't develop a high viral load, which can be highly problematic and increase the severity of the infection. There was an important study published during COVID that actually changed my concept of implementing the saline solution used in nebulized peroxide. This study showed it was an in vitro or in cell culture concentrations used a 1.5% sodium chloride solution. They were able to achieve 100% inhibition of SARS-CoV-2. Lower levels of saline, like 1.1%, achieved an 88% inhibition. Now, this is why I changed my recommendation to using the salt concentration in nebulized solution from normal saline, which is 0.9%, to a hypertonic solution that they use in this study, which is 1.5%. Now, thankfully, you don't have to worry about finding out where to purchase this magical saline solution, as you can easily create it at home. And let me tell you just how to do that. All you need to do is take 1 pint, maybe a glass pint of purified or distilled water, and put 1 1/2 teaspoons of a high quality salt into the pint of water and mix it really well. And that will essentially turn the water into a 1.5 solution of hypertonic saline, which is the same concentration they use in the study I just showed you. Now, please, though, be sure to carefully measure 1 teaspoon and then a 1/2 teaspoon with a stainless steel measuring spoon. Don't use a regular kitchen teaspoon. You need to have an accurate measuring spoon. Alternatively, you could use a kitchen digital electronic scale and measure out 7 grams of salt. If you notice any nasal burning or irritation, though, when you nebulize or have a cough with the 1.5% solution, you might want to lower the concentration back to normal saline, 0.9%, which is isotonic. And all you need to do this is decrease the salt to 1 level teaspoon. Just remember, though, that the saline solution may be every bit as important as the peroxide. This is for several reasons. Probably the most important reason is that you should never nebulize with distilled water, because it's a hypotonic solution, which will cause serious damage to the lining of your lungs. You must always use some salt in the nebulizing solution. Not only will this prevent the damage to your lung epithelial cells, but the saline solution has highly effective actions against the viruses that we've just seen in the last study. Now, there's another study that uses a different approach. It's a nasal irrigation with normal saline. They found that people were 19 times less likely to require hospitalization for the treatment of COVID-19 than the national rate of hospitalizations. Nasal irrigation, which is sometimes referred to as a nasal lavage, is a relatively popular method for relieving cold symptoms, and many use a neti pot to achieve this. This is an ancient technique with roots in the traditional Indian healthcare system. Now, there are other physicians like Drs. Brownstein and Peter Mercola who have advocated for the use of iodine in the nebulization mixture. Now, I personally have not found it necessary to use iodine, but respect those who do use it. If you do use it, the dose is quite small, typically only a drop or 2 in the nebulization mixture. Now, another simple and convenient option available at most drugstores or online is a canister of Neomed, all-in-one saline nasal wash. Now let's fine-tune the instructions for my absolute favorite intervention for acute upper respiratory infections, hydrogen peroxide nebulization therapy. This is my go-to first treatment choice, and the reason I always travel with my nebulization kit is I typically nebulize at least once during my travel. Let's start with the basics. What is nebulization therapy? It's merely inhaling a liquid with a medication in it, and in this case, hypertonic saline, and a diluted concentration of hydrogen peroxide. You put the saline and peroxide solution into a nebulizing device that aerosolizes the mixture to make it easy to inhale into your sinuses and lungs. This allows the vapors you're nebulizing to reach those areas in your body you're seeking to treat. The mucosal linings of your sinuses, your throat, and your nose, and of course, your respiratory tract. One of the reasons why nebulization therapy is so effective is because you're allowing the saline and peroxide to go exactly where it needs to, which is where the virus is settled in your body. If you can get the peroxide solution to where the virus was deposited in your nasal cavity, your throat, the hydrogen peroxide will function as a topical local disinfectant and help to kill the virus. It's best, though, to use food-grade hydrogen peroxide because it has no stabilizers. In an emergency, you can use the regular 3% peroxide you get at the local drugstore because you're going to be diluting it 30 times. So you're not going to be getting much of the stabilizer in there if you use the regular peroxide. If you do use the food grade, it's best to store what you currently aren't using in the freezer so it'll last longer because there's no stabilizer in it, so it tends to deteriorate more quickly. It typically thaws out, though, in about 30 minutes, so it's not terribly inconvenient to put it in the freezer. Food-grade peroxide typically comes in 3 different concentrations, so 3%, 12%, or 35%. Most commonly is the 12%. So depending on the concentration, though, you're going to start with determines how much of that peroxide you're going to add to the pint solution that I just instructed you on how to create. There's a wide variety of doses that clinicians recommend for the peroxide nebulization, but I am recommending that you start with a small concentration of 0.1%. So if you started with your hydrogen peroxide concentration of 3%, which is the typical one in drugstores, you would be diluting it 30 times. If you started with a 12% concentration, you would be diluting it 120 times. Now, you don't, fortunately, need to be a math wizard to make up your peroxide concentration correctly. All you need to do is start with the saline solution that you made up with the directions I gave you in the last section. Then follow the chart I created for you and add the appropriate amount of peroxide into the pint of saline solution that you created earlier. If you're using the food-grade peroxide, the most likely concentration is going to be 12%. So this means you merely add 1 level measured teaspoon of the 12% solution into the salt water you have created, and voila, you have 0.1% nebulizing hydrogen peroxide solution. So now you have your peroxide solution all set. You've got the right concentration of saline and peroxide. Of course, you're going to need a nebulizer or a device that will convert that liquid into a mist that you can inhale. There's basically 2 different types of nebulizers that you can use. They're both available online in many stores. They break down into inexpensive handheld devices that are typically less than $25 and are powered by AA batteries, or more expensive version that use an AC plug and cost closer to $75. Since this is a device that can save not only your life, but those that you love, I suggest getting the higher quality one. But if you can only afford the lower one, that would work too, just not as good. The one I recommend and have had good results with is the Trek S, which is a battery-operated piston compressor. It used to be available on Amazon, but I believe they stopped carrying it. But all you need to do is type that name into the Brave browser, which is my recommended internet browser, and then use the shopping tab, and you can find dozens, maybe hundreds of outlets that sell it. Now, the Trek S has an AC power supply that comes with it, but if for whatever reason, if you want it to be more portable, you can buy for another $75 a lithium-ion battery that accompanies it. And understand, though, this is unnecessary, and I don't use it, but if you feel you want that portability option, then it's available for you. The next point to consider is the interface that you're going to use to get the solution into your body. Many, if not most, of these nebula devices are designed to deliver medications into the lungs. And for this purpose, they give you a mouthpiece, which effectively does that, delivers the medication directly to your lungs. However, as we discussed earlier, the researchers have found that the viral load of SARS-CoV-2 and most other viral infections tend to be heaviest at the sinuses and nasal cavity, not your lungs. This is precisely why you want to skip the mouthpiece that many of these nebulizers come with and use a mask that will cover your nose and mouth and allow you to get the peroxide and saline into your sinuses and nasal cavity. If you use a mouthpiece, the vapors will get into your lungs but bypass your sinuses and nasal cavity, which have far more viruses, and this will radically decrease the effectiveness of the therapy. Now that you have your nebulizer with mask attachment, saline and peroxide solution, you're ready. So you start this by pouring about a teaspoon or 5 cc's or mLs of your pre-made peroxide saline solution into the top of the nebulizer. I typically store the 1 pint solution in the fridge that I made up, and I pour it into a smaller 2 to 4 ounce glass container that I store with the nebulizer that's not in the fridge. This is merely for convenience. The original large food grade bottle of peroxide is frozen. The pint solution you just made up is refrigerated, and your small bottle is at room temperature with your nebulizer, and it's just much more convenient to do it that way. Now, it typically takes, once you start the nebulization process, about 5 to 10 minutes to fully nebulize the 1 teaspoon of the solution. The next question then is how frequently you need to do this. It depends. If you're really sick, you might want to do it every hour or 2 until you're feeling and breathing better. If you're doing it as a preventive measure after an exposure or the very first symptoms of an illness, you might only need to do it once or twice. Now, the sooner you implement these strategies, the better they're going to work. You'll want to do this treatment at the very first symptom you have. I mean, the very first symptom. And please, please, please do not wait. It's absolutely vital that you acquire a nebulizer before you need it. You will have very serious regrets if you do get sick and haven't done the prep work to have this resource available. Time is of the essence. Waiting a few days to get this equipment can put you behind the 8 ball, as you will miss the most important early treatment window. If you get sick after you go to sleep, you can even wake up and nebulize. I had a friend do this and her symptoms disappeared immediately, and they normally would have progressed to a severe infection. And this anecdote massively reinforced the importance of early treatment. The sooner you treat it, the more effective it will be. The longer you wait, the harder it is to treat as the virus continues to replicate and increase in numbers, making it far more difficult to control. This is why I can't stress the importance of this next point enough. You simply must always have the peroxide solution and nebulizer on hand. The last thing you want to do is get sick, search for this module, and find out what you still need to order. No matter how soon it gets to your house, which could be days or even longer, it will not be soon enough. This is because every minute you delay, the lower your chances are of responding effectively to this intervention. You simply must have this equipment in your home. So please, if you don't already have a nebulizer and peroxide now, promise me that you will order them today. This is crucial. Now, below this video, you will find an excellent instructional video that I created during COVID-19. The instructions have been slightly modified, so I inserted a few clarifications to avoid any confusion. Now, most of the time, the peroxide saline solution will be all you need. But if you aren't responding, there are other strategies that you could implement. You should certainly be on the zinc quercetin, liposomal vitamin C, and molecular hydrogen regimen that I discussed earlier in this module. If there are any questions or concern, you should not hesitate in seeking the assistance of a qualified healthcare provider. One option that helps many is intravenous ozone, and there are many physicians that provide the service. An additional option, if you need one, is contacting the Frontline COVID-19 Critical Care Alliance, or FLCCC for short. And Dr. Paul Merrick and Pierre Corey founded this. We put a link to their site on this page, and their site has a list of protocols that you can use and providers that you can access.